From the Carl Chevrolet Studios, I'm Terry Rich. Good morning. Sounds like we're going to get some wind here in the next couple of days, and we've got some fun guests today I think you're going to enjoy, including Dr. Josiah Fitzsimmons, who is with Vero Neuropathy. And Dr. Fitzsimmons, you asked me a question. You and I have a common contact. What the winning lottery numbers? I just have to tell you, I haven't been with the lottery for a couple of years, and I've won all. So I can play now. I've won all of $4. So I'm probably not the right person to ask. But I'm telling you, millions of people across the U.S. Have suffered from peripheral neuropathy, if I can get that all out at once. And you and I are going to talk a little bit today because you're the founder of Vero Neuropathy, and I always thought until recently that pain from neuropathy was endless, that it was untreatable. Is that the case?
No, that's not the case whatsoever. And unfortunately, that's what so many patients have been told, is that something they just have to live with. They need to take drugs the rest of their life, and they just got to deal with it. But at Vero Neuropathy, we actually diagnose the cause of their condition, and we come with a unique plan. I mean, we have people that come in here in wheelchairs and walkers that are walking out perfectly fine. We had one guy hadn't felt his feet in over 20 years. The guy's feeling completely back in 6 weeks. So this is definitely not the case.
Wow. Tell me about the tests. What are the tests that can determine whether you have this condition?
Absolutely. So we utilize 8 different unique tests to actually calculate down to the exact percentage of loss that someone has in their hands or their feet. And so vibration sensitivity, skin sensation, differentiation between sharp, dull sensations, hot, cold, electric sensations. We actually test all the different types of sensations that someone has, so we can really figure out someone might have neuropathy and have numbness and tingling. Someone might have neuropathy, have severe pain. Depending on what nerves are impacted, the sensation and the symptoms can be very different, and we want to figure that out for each individual.
So is it very difficult to actually identify neuropathy in a patient?
It can be. One of the number one causes of neuropathy is what's called idiopathic, meaning unknown cause. You know, a lot of people do have diabetic neuropathy, exposure to different toxins, Agent Orange, result from chemotherapy, or even physical damage to their body. But unlike heart disease or cancer, where you may know exactly where it's from, with neuropathy, there's so many different kinds. It's hard to know where it came from, how it happened, and most people are just prescribed, dangerous medications. On the most serious cases with diabetic neuropathy, there can be open sores, tissue can be destroyed. It can result, like I said, in walker, wheelchair. Worst case scenario, we've seen people that have already had their feet, toes amputated.
Wow. Is there, if someone thinks they have neuropathy, what's the thing they should do, or what's the next steps in being able to diagnose that?
Absolutely. I mean, number one thing they need to do is they need to find a board-certified doctor that knows what they're doing with neuropathy. That's, like I said, this is what I specialize. Most people just do neuropathy on the side. They're a neurologist, a podiatrist, just a general physician. Only a few people that they treat neuropathy. That's the only I specialize with on a regular basis. One of our patients, Kay, she's actually a doctor herself who was waking up 3 to 4 times a night, terrible symptoms with neuropathy. Go ahead and play that for you.
Now I can count probably twice in the last several months where that's happened. So that's significantly improved. So that was the primary reason. All the others I consider kind of added benefits. But I can stand a little bit longer, and I could walk a little bit taller, a little bit stronger, I guess I would say. But definitely sleep better. And a couple other things, I have really, really high energy level anyway, and it's even increased my energy, and I can't even believe I'm saying that, but.
Hey, there's a great testimonial from Kay. I know you have a special to be able to check if someone does have questions and/or would like to be tested. Tell me about that.
Absolutely. When someone comes in, we'll do a full personal consultation. We'll do those 8 different unique tests, figure out exactly what's going on in their hands and their feet, get a definitive diagnosis, how much sensory loss they have, and then we'll create a whole custom plan for each individual that comes in.
And as we're taking a look at the special that you have going, tell me, if someone is suffering, how soon could they get in?
We have 7 doctors all in our one location who all specialize in neurologically based care and working with the nerves. So that's why we get such great results with neuropathy. Most people can get in within 48 hours, get in as soon as possible, start getting some results, start feeling better already by Christmas.
Dr. Josiah, thank you so much for joining us today. And when you think of a sure bet is to find out from professionals like you if you think you have symptoms of neuropathy. Thanks today. If I get that winning number, I'll give you a call, all right?
All right, that sounds good.
All right. Thank you so much.